My name is Robin Stevens. I'm an oncology nurse practitioner with a specialty in breast cancer and also in genetics. I've been an oncology nurse for approximately 25 years. And primarily, we've always treated patients with chemotherapy, and there was very little emphasis on prevention of cancers. And in genetic testing and screening for hereditary cancers, it's very exciting because we're preventing cancer from happening by testing patients to see if they carry a gene mutation that may be responsible for the cancers in their family, and screening them and other family members.
I think genetics is really the key to the understanding of many diseases. And we're learning more and more about genes. We're going to understand more and more about cancer and what predisposes it. We now know with breast cancer gene 1, it's high up, that 60 to 70% of patients who have that gene will get breast cancer. We now have a group of genes that 30 or 40% of patients will get cancer, and we're finding these genes that increase the risk maybe to 20%, so that there's going to be a continuum of genes that are associated with cancer. And as we are able to do more and more testing, we'll be able to identify these patients. Initially, we would test people, and could be very frustrating that we would do BRCA1 and BRCA2 testing, and they'd have a very strong family history, and we still wouldn't identify the cause of cancer in their family. With the expanded testing, we're able now to, in a more cost-effective manner, screen many genes at the same time to identify what's causing the cancer in that family.
So when the cancer panels initially came out, we weren't sure what role this was going to play for our patients. However, I have used the cancer panels and have been very, very happy because rather than, for example, let me just give you an example. We have a young woman who is in her 30s who has a strong family history of breast cancer and maybe other cancers, and she is negative for BRCA1 and 2. Well, there has to be something else going on. So the genetics panel, such as the BreastNext, offers that opportunity to test them for other syndromes, whereas before, at one time, whereas before we would test them for Li-Fraumeni, and then if that came back negative, we were going to Cowden's and then maybe something else. So by doing the BreastNext panel or the BRCA Plus, we're able to look at these other syndromes with one test rather than putting the patient through multiple tests and the expense of multiple tests.
We work with Ambry because they offer the group of tests available in a cost-effective manner, and we feel confident in the quality of the results.
I use Ambry Genetic Laboratories because of the customer service that I receive, the people that I deal with. Anytime I've called Ambry, they've been just wonderful. They'll bend over backwards to accommodate you, to assist you to get your tests done. There is the other thing that I really like about Ambry is the pre-verification of benefits. That has been a real peace of mind for my patients when I submit their test, to have that in front of us and say, you know, your test is covered 100% and here's the paperwork, and Ambry will honor that.
Because of the ability to do reliable testing, for instance, Cowden's syndrome, which is a syndrome that occurs in breast cancer, we really had nowhere to do testing for. Li-Fraumeni was very expensive, and the results could take a long time to get back. In the past, a lot of the testing was done by universities where the turnaround time may not have been quick enough to really benefit the patient. So that to have labs that do the testing, that we can get the results back in a timely fashion, is really important.
When I first started submitting tests to Ambry and receiving the reports back, it not only gave me the results, but if there was a variant, there was a lot of detail that went with that variant, such as the different testing that was used to determine whether it was a polymorphism or a suspected deleterious, and the reason for that. And when I first received these reports, I was like, I need to talk to one of the genetic counselors at Ambry and discuss this. And they are so happy to go over all these results and explain what they mean, so then I am able to give that information to the patient when they return for follow-up.
What we want to do is come up with an answer for why the cancer occurred.